actually offered up to forego this portion because we've had so many great presentations and didn't want to cut those short. Because what I'm really going to talk about today, and it's not to belittle the work at all of this body and our local healthcare system preparedness, but we have other venues that we can share that work in, and we know that we all get to see each other every other month to continue this dialogue. But Travis has granted me the time to go ahead and go through and follow on the heels of Captain Bates' presentation and to bring it down to more of a regional and local perspective for where we're going forward. Because it really isn't, Ebola was the impetus, but it's future threats and overall improved response to infectious conditions that is what will be lasting and enduring from the tragic experience of Ebola in West Africa. So my presentation is about Ebola and beyond. And I just described what this slide is, world perspective down to our local coalition. So Ebola, I'm not going to really cover much about the lessons that we've learned locally. We had a terrific, at the end of April, Ebola symposium, during which Peg Curry and Mary Jo Moore from Sacred Heart Medical Center presented on the lessons and the actions that they're taking as an institution to become an Ebola treatment facility. We heard from Scott from American Medical Response. I've got his name written down so I can remember. Scott Bourne. Our State Department of Health, Scott Lindquist, was here to talk about public health. So we learned a lot already about what the actions to date have been in preparation for Ebola. So what I want to focus on in these next couple of minutes is what has the country done to help infuse resources and guidance to the state and local level to help us move forward. The Healthcare Preparedness Program, which is part of the Assistant Secretary for Preparedness and Response Program at the federal level, has appropriated dollars to continue this work. And the first pot of money that's being brought into states is what they're calling Ebola Part A. It's over a 5-year period, and that's a total award so far for Washington State. But the goal is that we're focused on healthcare coalition and collaborative entity of these partners, treatment hospitals. Sacred Heart is ours in FEMA Region 10, which is Oregon, Washington, Idaho, and Alaska. There are 8 additional assessment hospitals in our state, only 1 in Eastern Washington, Providence St. Mary down in Walla Walla. There are 2 other hospitals in our state who will be able to become treatment hospitals on a much smaller scale, and that's Harborview Medical Center and Children's Hospital on the west side. But then the activity also needs to continue around working closely with our EMS transport partners to make sure that handoff of an infected patient is safe and effective and good care. And everyone else in our region that's a healthcare facility, whether it's a hospital or a large clinic, is a frontline facility. So helping to become better prepared and remain vigilant. And what does that look like going forward so that we would be able to identify quickly, isolate quickly, and inform. The second pot of money that's specifically addressing Sacred Heart's commitment to becoming a treatment facility and to build a 10-bed isolation unit on their campus in Spokane. And then there's specific activities really focused on the public health aspects of disease mitigation, direct active surveillance, You can read the activities that are there, but EMS transport plans, isolation and quarantine should numbers grow quickly, those types of activities. So that's the goal of the work going forward. And I think Captain Bates' comment and perspective that he's provided to us is so valuable in being able to keep the sense of panic low, keep the actions as simple but as comprehensive as they need to be, because that's what's going to allow us to really continue forward and sustain the improvements that we're making and the lessons that we're learning now. So for me, there's a lot of questions that are going to drive this continued and future work. And my goal today is to really actually leave us with more questions than we have answers as we move forward. But it really will be the underpinning of our future conversations. How do we in this region, as community clinics, rural emergency departments, urban emergency departments, talk to each other? What happens when an infectious condition or person with an infectious condition shows up at those doors? How do we support each other within a system, whether that's Providence or group health or community health services? And how do we support each other across systems? Because bottom line, we're all invested in caring for the patient and protecting our personnel, regardless of who they work for and where they come from. Standardization is kind of an underlying theme that's being talked about across the country. Is it even desirable to standardize personal protective equipment in a healthcare setting? If it's desirable, to what level? And if it's desirable and we can decide to what level, is it even possible? There's so many different components at play in what determine the different personal protective equipment that's being used in any given facility. Are the transport protocols consistent? And are the communication and notification protocols consistent? Again, if we can quickly identify, quickly isolate, and inform, how do we do that so that we're all on the same page? Our region, much like Washington, the rest of Washington, is really rural. And we know that medical personnel in particular work at a lot of different facilities. And so is there having standardization in terms of how we respond and improve our infectious control measures would help, might help, I don't know, these are the questions, make it less confusing for those staff when they move from facility to facility. And then over the long haul, how do we make it sustainable? So we heard this in public health and your healthcare coalition leadership as a huge call to action, not just because the federal government has put an emphasis on this and has appropriated funding to it, but because it is in line with everything that we do as a healthcare coalition and as foundational public health, disease mitigation. And so some of the actions that are happening is that we have successfully competed for some additional dollars to come into our region. We're an Ebola Preparedness specialist, a coalition outreach coordinator to work really closely with Travis to continue to build the membership and actually make the meaningful work move forward. WA Secures is our statewide notification system for the health community. It's where we push out the health, what does HAN stand for, Lindia? Health, thank you. The Health Alert Network from the federal to the state and locals. That's the state. We have a focused work plan, and our goal really is continued collaboration and support to the community. So those are our immediate call to action to move this work forward. Our health care partners, all of you, some of the call to action includes engaging in this work in your own facility, every facility, whether you're designated with a special designation from the federal or state level or not. We all know what we're going to be faced with at our doors. In the fall, there will be an Ebola readiness assessment or gap analysis, not sure yet of the title, to help measure where everybody's at and find out where the gaps are so we can focus energy and help bridge those gaps. We have a healthcare system operational response committee, which is really about operationalizing what we do as a healthcare coalition to support any given institution or situation. And then to revitalize or re-engage with, if you have a citywide infection control committee, in Spokane there's a citywide infection control committee, or if there's something similar in your own communities, where you as infection control practitioners come together to talk about all kinds of issues. These conversations belong in those meetings, and so help bring that to them.